Thank you very much. I'm really excited to be here tonight, too. And hopefully, when you leave tonight, everyone will have a little bit better understanding of what arthritis is. And then the main thing is what exciting new technologies is available to you to solve your hip pain or knee pain or whatever joint gives you the aches. So what we're going to do, I'd like to start a little bit at first to just discuss arthritis. And then we'll go into the new techniques, which I think most of you are here to really learn about tonight. So what is arthritis? Arthro means joint, itis is inflammation. So basically, all it means is an inflamed joint. If you're here, you probably know about the symptoms already. And usually the symptoms of arthritis is pain, joint stiffness. It usually starts out mild. First thing in the morning when you get up, you kind of have to limber up, and then it gets a little bit better as the day goes on, but then if you're up too much, it bothers you again. As time goes by, it gets a little bit worse and worse. You'll notice when the weather changes, it probably hurts more than the nice, dry, summer times. So you're lucky in living in Texas instead of living up on the East Coast because you'd be hurting a lot more. And then ultimately, as it progresses, you end up with deformities. Now, as I was mentioning, the types of arthritis, we classify them as three broad categories. And the first type is osteoarthritis, and that's just the plain old wear and tear arthritis. It's the most common kind. Over 20 million people in the United States suffer from it at any one time, and it's just the plain old wearing out of a joint. The second most common time is inflammatory arthritis, and that encompasses in rheumatoid arthritis, lupus, and these are different. Osteoarthritis is just a mechanical wearing, whereas the inflammatory arthritis is actually diseases. They eat up the joint. So it's very important to get a diagnosis early because inflammatory arthritis needs to be treated medically to stop that rapid progression. So it's very important that you get a diagnosis of what kind of arthritis you have. And then finally, traumatic arthritis is where if you have trauma to the joint, such as a fracture, that heals, but the joint may not heal perfectly smooth, and so then it will wear out as you use it over time. And so that's the three broad categories of arthritis. Here's an arthroscopic picture of what a normal joint should look like. You know, a joint should be covered with cartilage, like the glistening of a chicken bone, that smooth cartilage. We need that for our joints to slide smooth and pain-free. X-ray-wise, what that looks like is cartilage doesn't show up on X-ray. It's radio-opaque. So it ends up as an empty space. So if you look here, you'll see here's the socket, and there's the ball of a hip joint, and that empty space isn't really empty. It's filled with cartilage. But we can tell how thick that cartilage is by getting X-rays, and that gives us a hint. And this is a normal X-ray. If you look at this X-ray, you notice it's much different. This is an X-ray of an osteoarthritic joint. And you'll notice that there's some cartilage left over here, that empty space, but up here, there's no cartilage. The bone's just rubbing on the bone. And you'll also see these kind of dark areas here, and that's some degenerative cyst that's a response to the wear and tear changes. And that's a typical osteoarthritis. Rheumatoid arthritis, as I mentioned, it's not just a wearing out, it's a disease that eats up the joint. And so if you notice here, you'll see there's a global loss of the cartilage space. That's because the inflammatory processes has destroyed that cartilage more globally. So what's the treatment goals? Well, obviously, our treatment goal is to relieve pain and improve function. That's why you're here. Early on, non-steroidal anti-inflammatories like Advil, Aleve, Motrin, those things can be very helpful at decreasing that inflammation because as the joint wears, it sets inflammation that can be very painful. Activity modifications. If you're a jogger or a runner and you start hurting, you know, after you run or jog, then you're going to come into my office and you're going to be really mad at me because I'm going to tell you you should give up the running and jogging. Now, I won't just say that. I'll say we should learn about more hip-friendly and hip-unfriendly exercises. But the trauma to it is what causes the pain. So we want to modify that activity so it doesn't hurt all the time. Weight loss is extremely important. That's another thing that patients get upset with me. Across your hip, in a single-legged stance, there's 3 pounds of body force for every pound of body weight. So even if you're only 10 pounds overweight, with every step you take, that's 30 pounds of stress going across your hip. And you can imagine how many steps you take every day, every week, every year. It really adds up. So just losing some weight can really be beneficial. Once the arthritis progresses, then we have other techniques that we try to use. There's some prescription anti-inflammatories, which can be helpful. Also, cortisone injections in certain joints can be very helpful. They're not very helpful for the hip, probably because the forces are so much greater across the hip. But for knees and the small joints, cortisone injections can be very, very helpful. And then finally, the use of walking aids, a cane to unload your joints can be beneficial. And we can baby people along for a long time with these type of conservative measures. But ultimately, if you keep using your joints, what's probably going to happen is that these measures are not going to be effective. And that's when we come into joint replacement surgery.